All right, welcome to Facebook Live with Dr. Brie. Happy Halloween week. I am wearing my fun Halloween wig to bring the fun back for this week and also for this amazing topic about perimenopause and our updates to our healthy hormones programs. I know everybody's tuning in today to hear a little biochemistry over lunch, so that's what I have prepared. So just, be mentally ready for that. Today we're talking about the perimenopausal journey and why we've updated our healthy hormones programs and our party. If you're local to Denver and a member of our clinic or in the community around our clinic and would like to come to our party, we're having a screening of the M Factor, which is a new documentary on the menopause experience. And we're really excited to be showing it here. I haven't actually seen it yet, so I can't wait to actually watch it and hear the language is coming out around kind of breaking the silence around the menopause journey. And several of the people in the movie are folks that I saw, doctors and other providers that I saw at the North American Menopause Society meeting last year. And it was an excellent course for me and an excellent kind of refresh on the current data for menopause. So I'm really excited to see what those physicians have to share in this upcoming documentary. So if you're around, that's on the 7th of November. So next Thursday, I will put a link in the to RSVP in the chat if you're interested in the comments for afterwards. But I'm hoping to shed a little bit of that silence today too around my experience as a healthcare provider, family medicine doctor, integrative medicine, and my experience treating hormones is going on before I even got into the zone myself. So I've been working with a holistic OBGYN mentor since I was in my third year of medical school, which was a while ago now, 2006 to be exact. And we had a great time just learning the process. And over the years, I've kind of gathered more and more info. And now that I'm in the 40s zone myself, I have a lot more data for people and a lot more has come out. So I have a couple of educational pieces here. Here's the first one. I want you to memorize this if you're in your mind as a multi-level waterfall in Hawaii. I think we've talked about this here before, but basically a hormone journey starts with the top pool of this multi-level waterfall. So it's like a cascade, and it's a very simplified version here. So this is Dr. Brie's family doctor's simplified version of how the hormone cascade goes and why we have at our program the full background, not only of blood work to look at your hormone journey, but also saliva testing to look at your stress history. So the reason we do this, we do a full panel that also includes like 17 different labs on your blood draw too, for one thing, the top of the pool here, which is your cholesterol level. So a lot of the backbone for this biochemistry starts with cholesterol, and it provides a backdrop for a lot of your hormones. So your cholesterol level, while it's beneficial to have it low for your cardiovascular disease risk, if you start low at the top of the pool, you kind of start low with some of those fundamental building blocks. So I'm always keeping an eye on cholesterol for anyone dealing with hormone or mood components. The next waterfall we have is called pregnenolone, which is a precursor hormone. And some people use pregnenolone. You'll see it at like Vitamin Cottage and the like natural grocers, any sort of health food stores. It's a precursor hormone. A lot of holistic providers will use pregnenolone as a prescription, recommendation, a nutraceutical. I personally don't like it because it's a precursor. It's way up here on the cascade. So if we're talking about our picture here, we have cholesterol and pregnenolone way up here on our hormone cascade. Yes, this is hand-drawn Dr. Brie amazingness here. I don't think it's super helpful when I give something that starts way up here when I want to influence the end of the line. So some people might want to influence the whole cascade. That's the indication for that nutraceutical, but I've never had people really symptomatically benefit, so I don't use that in my repertoire. But the next offshoot is progesterone. And progesterone, of course, we know balances out our estrogen and helps with certain parts of the hormone cycle, including helps you sleep, helps in some positive ways, but can also, be one of the first offshoots that we see here. The next one is cortisol. Do you see this little cortisol right here? So this is cortisol. That's your chronic stress, and it's right next to its friend DHEA. So unlike, you see there's a teeter-totter there, unlike a regular waterfall where the water only goes down, this is a place where biochemistry can go back and forth. So a lot of holistic medical providers will talk to you about your chronic stress, because we see the influences of chronic stress in many different realms, in hormone health, mood health, and even in weight around your middle. So if your cortisol is chronically elevated, we'll see weight right around the middle, which a lot of people get during perimenopause and menopause as well. So my current practice is to look always at a cortisol curve in anyone, male or female, or anything in between. Any person who is dealing with chronic stress, we will see symptoms that can manifest like hormone symptoms, fatigue, weight gain, brain fog, weight around the middle, just not feeling like yourself anymore. And we don't want to put that on an estrogen problem or a testosterone problem until we've ruled out that it's not related to something else like your thyroid or your chronic stress, because there's a big overlap there. Cortisol and DHEA balance each other out. So if we see somebody who's been chronically stressed, sometimes they'll have a normal looking cortisol curve on a saliva test, but the DHEA will be very, very low. And that tells me they've been borrowing from their DHEA so that they could preserve their cortisol balance. So this is where people borrow from, just to make sure that they get that fight or flight recognition, that fight or flight response as long as they need it. And sometimes by the time somebody's looking at either menopause or andropause changes, they've been chronically stressed for a couple of decades. So this is really important, especially in our society post-pandemic, to really look at and drill down on your chronic stress. And if there's something that we can do, for example, if exercise and meditation and getting outside is a good prescription for you and you don't yet need hormone replacement therapy, that's good to know, right? Those are really safe things to add in that don't require a doctor or any sort of monitoring. The next one we see off of DHEA. So DHEA is a precursor to testosterone, okay? So sometimes we'll see DHEA kind of gets pulled from both sides, especially in women with PCOS, but we see this as a super important precursor for men on their testosterone as well. So a lot of supplements for testosterone boosting will include DHEA, and DHEA can be a useful and helpful precursor, but again, if I don't know if I need it, right, then it's hard to know if it's good for me to be taking it. DHEA is evaluated in our program during when we use the saliva testing from ZRT Labs. So we test estrogen, progesterone, DHEA, and 4-point cortisol curve to look at this full cascade in you, in addition to the blood work that looks at the thyroid in detail, your vitamin levels in detail, your cholesterol level, and then all the metabolic factors that influence how people feel in midlife, including diabetes screening and all of that. We want to make sure we touch all of the bases so that when we give you personalized advice, it's really based on what's going on with you, not just saying, oh, it's just your estrogen. Here, try an estrogen patch. You'll feel so much better. You might if that's the problem, but we want to make sure that we look at the whole playing field before we get to that. Because testosterone, you see, is even before estrogen. Estrogen's at the very bottom of this line. Testosterone has its little friend dihydroxytestosterone. So that's something that we want to make sure that we get enough testosterone, but not too much DHT, because this can cause acne and hair loss around the, see, I'm not having this problem. Hair loss right around the frontal spots here. That can be from too much testosterone getting to its little friend, the biochemistry, the last of the line, the DHT. So there are things we can do to prevent that conversion, like saw palmetto, for example. So men in our practice who are on testosterone, we want to keep testosterone in the lane of testosterone. So we give an aromatase inhibitor here so it doesn't go to estrogen. You don't get man boobs from your testosterone level going up too high. And we stop it going from testosterone to dihydroxytestosterone, either with prescriptions or with saw palmetto, which stops that conversion so that the testosterone stays in its lane and doesn't enlarge the prostate or cause this increased hair loss or acne that it can sometimes do for women who are on testosterone replacement. So again, we want everything balanced on this waterfall, and that can be a challenge both based on your own biochemistry and also on what you're taking. That's why it's always good to have a personalized provider when it comes to doing any sort of home run work. And the last place here is estrogen metabolism. So see, this is our little estrogen here. We have the good, the bad, and the ugly. These are 3 different ways that estrogen is excreted in your body. And your body has an amazing way of balancing out your hormones and also in tagging things for trash. So your body actually does this really cool thing called methylation, and it tags a methyl group on something that's ready to go, so that your kidney can say, oh, that estrogen now has a methyl group on it, so it's ready to get excreted. But estrogen gets complicated in how we excrete it. And the simple way of understanding it is there's a good way to get out of your body, there's an okay way, and then there's the not so good way. And the not so good way is a way that happens a lot when we take estrogen orally or we take synthetic estrogen. So when you take oral estrogen or any sort of synthetic estrogen, it goes through the liver in a thing called the first pass effect, and it can excrete in the way that creates more pro-inflammatory molecules that we call the 4-hydroxy or the 4-methoxy excretion. And those levels, if they're high, we think contribute to the more pro-inflammatory side effects of estrogen that can be dangerous in some people, like blood clots, not being good for people with migraines, contributing to increased risk for heart disease and heart attack. Those are all things along the side of not good estrogen, right? Or even contributing to breast cancer risk if that's present. So when we look at estrogen metabolism, we want to make sure that we do not use the oral estrogens in somebody who's perimenopausal or menopausal. When you use the transdermal patch estrogens, which you don't put on your arm, put on your belly. But the skin, when it goes through the skin, we don't have that same first pass effect. So that's one thing you can do if you end up on estrogen, is to make sure you're on a good bioidentical kind, but a kind that goes through the skin instead of in through the mouth. Even though it's not as convenient, it is safer for you. The second thing to make sure of is that you're not chronically constipated. Constipation is a part of the hormonal cycle. Many people are constipated in the second half of their cycle, but people who are chronically constipated can increase some of the chemicals that the stool makes, and that creates more of that first pass effect, bad type of estrogen. So that's another thing that you can do to manage your hormone levels, is just make sure you're pooping regularly. If that looks like fiber, water, magnesium, whatever you need to do to make sure you're really truly regular, that's a thing that you can do for your hormone health. And then the last thing you can do is you can understand the genetics that you have that help you to excrete that estrogen. So our hormone program, we just added a urinary estrogens evaluation where you can have your good, bad, and ugly estrogens evaluated in a urinary dipstick. So you actually pee and collect some samples, send it off to a lab who's specialized to give us the ratios of good, bad, and ugly for that excretion. And that test comes with the opportunity to do genetic testing for two important influencers for how you metabolize and detoxify all hormones and some of your neurotransmitters. And those big players are the MTHFR gene and the COMT gene. Those two impact how you let go of and complete this detoxification process. So when we know those genetics for somebody, we know what you're potentially at risk for, and we can mitigate those risks by nutraceuticals or lifestyle choices. We can even make prescription choices differently depending on what we see in our results. So for example, if you're somebody who doesn't do that good, bad, and ugly thing very well, we might put you on something like DIM, diindolylmethane, which comes from broccoli. It is what makes broccoli and cruciferous vegetables anti-cancerous. So if you eat lots of broccoli and cruciferous vegetables, then good for you, because that's super good for your health. But when we want to drill down on the need for that in our personalized program, we might put you on a supplement, because then we can predict exactly how much you're going to have in your diet. You kind of have to eat like 5 bushels of broccoli a day to get 100 milligrams of diindolylmethane. So it's a lot of broccoli, probably a little gaseous with that much broccoli. So we want to make sure that, again, if you are a person who needs to mitigate the pro-inflammatory effects of estrogen, if you're a person who has a genetic link to having more of that pro-inflammatory estrogen, or if your urinary estrogen comes back high for the bad version of the estrogen that we see metabolizing in your system, then we might have that conversation around healthy detox. What does healthy detox look like for you? Does that mean like nutritional changes? Does it mean that you need to make some dietary changes? Does it mean that we need to manage the stools and constipation? Does it mean that we need a different version of estrogen, or do we need to avoid estrogen? If your family history and your genetics and you got too much of the bad guy then we have to have a different conversation on risks and benefits for hormone replacement therapy. So that's why we added this update. That will be coming out soon on our website, and our members can always ask us about our new programs. We have 5 levels of healthy hormone assessment programs. That's for anybody going through PMS, fertility challenges, perimenopause, menopause, and men going through hormonal changes who are interested in testosterone therapy. And then we have our maintenance programs, which are designed around people who want to be on hormones for one reason or another. We have 5 levels of the maintenance programs now because it's important to understand that this journey is very individualized. Everybody comes in from a different place in their cascade, right? I want to know this whole thing about you if I can, and I want to combine my knowledge of where you're at with advanced lab testing with your family history so that I can make sure we make the safest decisions. Sometimes that means I need to know certain things about your genetics, and all of those come together in our assessment programs. Once somebody then decides that their symptoms warrant hormone replacement therapy, it's really variable how often we need to see you. So that's lined out in our new levels for our maintenance folks. Some people, if you're only on progesterone only for PMS, once a year is fine. If you're on a combination of, the patch estrogen with progesterone, because it has to be balanced, and or testosterone, then we do need to, in the early perimenopausal years, make sure that we're hitting the targets. Are the periods okay? Are they too heavy? Are they coming at the right frequency? Are the hot flashes creeping up on you? Like, what is going on with your symptoms? And are we making sure that your levels in the blood work are okay? We don't follow the saliva testing because the blood work is a lot more accurate way of following hormone levels, but I always like to check and make sure we're not getting too high with estrogen, because my philosophy is less is more. We want to have on the least amount of estrogen to control your symptoms and make it manageable, the transition and the journey for you with your hormones, but we also want to make sure that we don't overdo it so we don't end up with your estrogen in a place where we don't want it to be, on the bad side, right? So that's why we personalize in perimenopause every 3 months, sometimes every 6 months as the journey goes. And then once people are super stable and happy on their hormones and have really been across into the menopausal range, which is more than 1 year without a period, stable, non-fluctuating hormone levels, we can kind of coast there for a little while. And it's nice. It's a really nice place. So those are our stable hormone members. They might need once a year to check in. But once you hit 60, the North American Menopause Society recommends that you start having a conversation with your provider about the risks and benefits of being on hormone replacement therapy. Even the safe versions of hormone replacement therapy are not necessarily considered safe forever, because risks go up as we age for things like stroke and heart attack and breast cancer. So we have to have that conversation in your personalized situation between 60 and 65 if it's time to start going back down and off. No longer are we in the generations with people in their 80s on hormones forever, like people were before the Women's Health Initiative. But our pendulum is balancing back out, right? Hormones were all good when I was in med school, then they were terrible, and now we're coming back to there's a balance here that we can help you find, and that's what we're here for at Direct Osteopathic. So hopefully you can come to our party so we can talk a little bit more all together about these programs and about the experience that you're having. And if you're interested in our healthy hormones assessment programs and you're a non-member in Colorado, we do have that as an option. But if you need hormone replacement therapy, it's best in the setting of our direct primary care membership, because we really want to make sure we know everything going on with you, all your risk factors, all the history, all the medications other folks are doing on your team. That's when that primary care lens is really helpful to us, and we want to make sure that we're on a team and we know everybody on the team. So that's our update. If you have any questions, feel free to put them in the comments, or if you're a member, put them in the portal, or come to our Lunch and Learn on Wednesdays. I hope you have a great Monday. Bye.